Hi, good evening. My name is Yadira Jimenez. I am the nurse care manager for the medicated assisted treatment here at Ryan Health.
Hi everybody, I'm Dr. Siddiqui. I'm the medical director at Ryan Chelsea Clinton Community Health Center, and I'm also the director of the MAC program, a program we're going to talk a little bit more about later.
Okay. So today, me and Dr. Siddiqui, we're going to touch topic on opioids, and hopefully we'll be able to answer any questions at the end that you might have pertaining to this topic. So we're going to begin with what are opioids? Dr. Siddiqui, can you please elaborate on that a little bit?
Sure, really good question. So what is an opioid? We hear about it all the time. Opioid is a substance that makes a chemical reaction in the brain and helps people not feel pain, and also can cause something called euphoria, which is another word for meaning to feel happy. So this opioids have been around for a very long time. With the poppy seed, people have used heroin, what we call heroin, for hundreds of years. But now it's become a prescription medication, and it's a very useful medication to treat pain. It's been used for a few decades now. The most common names are Percocet, oxycodone, or fentanyl, and there's some street names for them as well, which Adira knows.
Sure. Some might know it in Spanish, or they call it cinco y doce. They also call it Roxy's for some. There's a lot of street names that it could be confused for, or kind of ultimately used as well. So knowing a little bit about opioids, so you said they would be people that would be prescribed opioids, like for surgeries or for like chronic conditions such as cancer, right?
Right. So a lot of medical providers prescribe opioids to treat pain, whether it's for a surgery or procedure, or you had a fracture. The issue comes up is that the substances, while they work really well to treat pain, can become addictive. And when I talk about addiction, I mean that people's bodies can get used to it, and then without it, people might go into what we call withdrawal symptoms, so feeling really not good at all. And also they could build what we call tolerance, meaning you need more and more of the substance to get the same effect. And these two things are what's led to what currently a lot of people talk about is the opioid epidemic and addiction. And the common thing that a lot of people think addiction is, meaning like the two things I said, someone that needs a substance and can't feels sick without it, or needs more and more of it. But we're now bringing about a new definition of addiction. And addiction really is very complex. It's not just about the substance, it's about how it affects your life. So addiction really, someone that's suffering from a substance use disorder or addiction, it means that it's affecting their life. It's affecting their relationships, it's affecting someone's ability to work or take care of themselves. So if someone is using a substance to the point that it's really being more negative in their life than a positive effect in their life, it's time to consider, is this an addiction disorder?
Yes, I think it's very important to know and to be aware that not your average person that you would think that is acceptable to having this misuse of opioids. It could be your neighbor, it could be your neighbor that is 80 years old that is taking pain medication for her back, or it could be the construction worker that you know down the block that is also taking pain medication for whatever reason, and it could lead up to the misuse. And it is very important to be aware of the concept that this medication, it works marvelously, but it can also have its complications.
That's right.
Yes. Okay. And so that brings us to letting you guys know that if you know anybody or are concerned or are aware that somebody's struggling with not knowing if they're going through this misuse of the medication opioids, definitely reach out to us at the Ryan Health. You can contact us. Well, you can contact me directly, actually, at 646-221-0366. The number is also on the page, and you can contact me directly. Also, we have the direct number for the call center that I know RCC has a different number, or do you have that? Or they could find that at the page as well.
Yeah, that number will be on the page. So we have the medication assistance treatment program, which is a really great program. We rolled it out about a year ago, and we've been treating quite a few people with the program. And the program has two parts. So it's called MAT, meaning medication assisted treatment, meaning medication to help someone who may have opioid addiction. The medication is called buprenorphine. The way this medication works is it is a medicine that someone takes daily, and it hits the same receptors in someone's brain where the opioids go to, and it helps kind of even out that need or that craving, and we prescribe this medication monthly. It's really a simple treatment, and that we can start easily. You would need an appointment first. You would meet with the nurse care manager, and she's going to go over a little bit about what she does. But for me, what it would be is it's in a primary care setting. So you would come to one of our centers. We also offer other treatment for other medical conditions as well. And you'd have a visit. I'd learn a little bit about you, find out about any medical conditions that you may have and what's going on in your life. And we might do some lab work, and then prescribe a medication to treat the same day.
Yes. So once you've been able to make contact with the center or with myself and become either pre-registered or registered, then the stages start to follow. The first stage would be with intake, and to me that is the most important part, because that's where we're going to build our relationship and our communication and our trust. Because this is definitely a medication that, you know, we trust you guys to follow through and how to take it accordingly, how it's prescribed. So it takes a lot of willpower to actually say, yes, I want to be able to take this medication and follow through with it. Anything else?
Yeah, so there's another medication that we also give, and this is a life-saving medication that a lot of you may have heard of.
Yes.
The naloxone. So the naloxone. So this is a medication that we give to everyone, and we give it for free at our centers, and we have also been distributing it in the community. So if you're around someone that you are concerned might be overdosing, it's a simple medication that you can squirt into each nostril, and it will help prevent an overdose.
Yes, and people also know it as Narcan kits. So we have Narcan kits readily available for anybody, whether you're a Rhine Health patient or anybody in the community that will need to have access to that. We have them readily available for you. Okay, so we wanted to talk a little bit also about what happens in the appointment. So we talked about intake, right, where this is where we build our rapport. Following the intake, the patient would go into stabilization phase, where at this phase, the patient would kind of decide, okay, this medication is working for me and this is something that I'm willing to do. And then we would take it from there. It starts with like a 1 or 2 week prescription, and then we would see what dose will help you. And that we would manage between you and I and the provider. Induction is made at home, whether it's with me on the phone or via, camera. It's a process that for some is more comfortable than for others, and we are here to be with you at that process if it's something that is intimidating.
Yeah.
Okay, treatment during COVID-19. Would you like to talk a little bit about how how our program is working marvelously through this pandemic?
Yeah, sure. So we had to make a lot of adjustments since COVID pandemic. We changed our visits, so we're not having as many in-person visits, and we're doing a lot of televisits. And what this allowed is to expand our program to people who may not have an easy time coming into our center. I realize that there's a lot going on in people's lives, and it could be hard to get to your doctor's office. So we are providing the service virtually, as long as you're able to contact us over phone or over video. A smartphone is completely fine. We can have a conversation, get to know you over the phone or video, and then if there's any necessary lab work, you can schedule an appointment to come in and prescribe medication that same day. I think it's been working really great for us, and for patients. I've seen a lot more people than before, and we realize that this is a really tough time for people right now, and this service is needed. And so I'm really happy that we're able to be here to provide this for you over a video conference or phone.
Yes. Another topic I wanted to touch on was insurance. A lot of people don't reach out for help because they feel that they don't have insurance, or the insurance that they have won't cover the cost to be seen or for this medication. And we implore you to please leave that aside. Please make the appointment, and we will take it from there. We have patient navigators that will assist you in getting insurance if you don't have one as of yet. And then we also have a great fee sliding scale
fee.
Yes, that will go according to your income, so it'll be something that you don't have to worry about.
Yeah, at the community health center, our mission is healthcare is a right, not a privilege. And what this means is we are here as a safety net. We're here for people to give the care that they need. It would be really tough for us to turn anyone away.
Yes. Okay. So if you have is there any questions?
We have a lot of good questions.
Okay.
So let's start with the first one. How do I know if I'm addicted to opioids as opposed to just taking them for pain? What are the addiction symptoms I should look out for?
So that's a really good question, and something we have to, a provider has to tease out for the patient. To be honest, I don't think there's a simple answer. It's really personalized for every patient, because pain is very complex, and the treatment of pain properly is important. And the medication that we use to treat pain can become addictive. So I would say, if you question or worry at all if you may be addicted, I would say talk to your medical provider, or come in and see us and we can discuss it. We'd have to learn a lot more about you, but it takes a little bit more of an interview to figure that out.
The next question is a pretty good follow-up. Why do doctors even prescribe opioids if they are so addictive?
That's a good question too. The reasons why they were prescribed, so like I had mentioned, these medications have been around for decades, and they are useful in treating pain. So there's a lot of conditions where people can be in severe pain, such as surgery, a fracture, and as people age, arthritis is a common cause of pain, very painful knees and hips, and we want to help people as much as possible. And I think that this medication, when used properly, can treat. But like every medication that's out there, the same thing like blood pressure medicine or diabetes medication is there's always some risk along with the benefit. So as long as you and your provider are aware of any possible risk of the medication, and you and your provider have a conversation and come to an understanding that this is a treatment that you want to use, then it's a great option.
How do I schedule my first appointment, and is everything anonymous?
Okay.
I'm going to pass that to Jerry.
Okay, so I can answer that. As I said before, you could definitely call me directly at the work number, which is 646-221-0366, or you can call 212-749-1920, and my extension would be 5829. Regardless of what call center picks up, you would want to speak to the nurse care manager, okay? And it is under MAT, nurse care manager, and there you would relay a message, and they would definitely follow through and give it to me, and I will be doing the following up.
And I would say that this is, we follow all the regulations. This is HIPAA protected information, and I understand that there's concern about privacy. There is stigma we didn't talk about it so much, but there is stigma related to treatment for addiction, and we understand that fully.
Yes.
We respect our patients' privacy and do not share that information with others. And if there's any specific concerns a patient of mine has about privacy, I do give them the opportunity to talk about it so that we could all be on the same page.
Will I be able to function on BOOP? Will I feel off or different?
That's a really good question. So people, many of my patients are functioning really well on BUP. They have full-time jobs.
Yes.
They, like Yadira was mentioning, there there's no judgment, and there isn't the like what you would typically think someone with addiction looks like. They are people in our community. They are our neighbors. They are our family members. They're someone who needs maybe a little bit help with treatment, but also still are going to school or working or taking care of their children. And this is a treatment to help you function better. So it's not going to cause sleepiness. It's not going to affect someone's ability to do things to take care of themselves.
Yes, so buprenorphine medication is what we call like a partial agonist, whereas Percocet or heroin, they would be considered full agonists. So yeah, the effects are cut down basically by half. So yeah, you are able to take this medication, not go through the withdrawals, and be able to function like Dr. Siddiqui said. More than half our patients have jobs and have family, and because of this medication, they are able to keep going forward and not feel isolated and not feel like they can't function in society anymore.
I would say they're actually doing better. A lot of our patients that we've been taking care of that have been really struggling, I've seen a few patients improve their relationships with their family members,
Yes.
reconnect with their children,
Yes.
and also some of them we've had cases where someone's actually referred their boyfriend or their girlfriend
Yes.
or their parent to get treatment after having a positive experience. So
Yeah. We also
definitely
even have
understand.
family members call in to thank the program because their parent or their loved one are able to go out in society and get a job or able to reunite with their family members, which at one point they were not able to do. So people don't see that as such a big deal, but it really is. And this is what, again, like Dr. Siddiqui said, this is what we strive for in this primary care setting, whether you decide to make it your primary care setting or just come in as for the MET program, it is sufficiently fine.
How does Suboxone work? What are its benefits?
Yeah.
So Suboxone basically is a brand name for the generic buprenorphine naloxone medication. Suboxone seems to work on its best when it comes to, like I mentioned before, it's a partial agonist, and it allows you to function as opposed to where if you're taking a full opioid, you are in an increased risk of overdose. If you say, okay, I have a little bit more pain today, I'm going to take an extra dose of the Percocet, you are in an increase of overdose as opposed to the Suboxone medication. You are fixed on a certain dosage, and that dosage usually works completely fine for you. And let's say, God forbid, you have an extra one, your risk for overdose is minimized completely.
Yeah, I would add, so Suboxone is the brand name, buprenorphine is a generic name, and Suboxone has two medications, and it has buprenorphine in it, and it has a little bit of the other medicine we talked about, Narcan, which helps prevent the overdose.
Yes.
How long is the treatment?
That's a good question.
That is a very good question, and it really depends case by case and up to the individual. So I've had patients where they've only taken the medication for about a month because they felt that they were dependent on the pain medication and they wanted to step down. So they entered our program, and after a month, they went happily on their way and was in no need of buprenorphine medication or the prescription medications that they were using illicitly.
Yeah. So I would say the treatment is as long as you need it.
Mm-hmm.
everyone's got different life circumstances. There's some people, a couple of months, they're able to change their habits, change their lifestyle, change who they're around. But there's others, it could take years. It could take years, and that's okay.
Yes.
Yeah.
It could be lifelong, and that's okay
and
too.
That's okay.
Yes.
Yeah.
Do any of your patients relapse? And how will I know when I'm ready to leave the MAT program?
Yeah, so I would say with my patients, I have conversations with them regularly. I check in on how they're doing. I check in on what's going on with their life. So we would have, you and your provider would have that conversation to see if you're ready to leave. And relapse is an interesting question. So do people have moments that they've had a tough time and they use another substance, or they take some extra oxycodones, or they use some heroin? Yeah, that probably does happen, but I don't consider that the end of everything. There's usually a situation that's happening that's caused that, and then we work. So if you think about it, treatment and addiction is a winding road, and there's going to be times where things aren't so great, and then things are going to get great again. And so I believe in the optimism. And so I guess the question is, could there be relapses? Sure, there could be times that aren't great, but there's always an upside to that, and there's always hope they can get back on track.
Yes, and I think that's what's important about this medication is that, yeah, there may be a relapse, but if you continuously take this medication, then you could get back on the road. You could get back to striving for what your goal was at the beginning, which is to be opioid free at the end. And I believe this also goes case by case, right? It's very individualized. It's up to the person, really. I've had some cases where they felt that they relapsed to a point where they would like to go to a detox program, and we are all for that. So, again, it's all up to the individual on what they feel they can take.
Is there a difference if you are treating someone who uses street drugs or prescription opioids? What are the street drugs you can help address?
Okay, so when we say street drugs and prescription drugs, at this point of the game, I think everything has gone to the streets, right? So we have prescription drugs that we also find in the streets, but when we say street drugs, we refer to as heroin. Prescription drugs that are found in the streets, whether it's mixed with fentanyl, which we can see a lot of that happening, are your regular Percocets, or even Ativans are being mixed with fentanyl at this point.
Yeah, so I do want to add to that. So today's conversation is about opioids and our MAT program. So the medication assisted treatment treats opioids, whether it's street or prescription. But I do want to open the door. We could have that conversation another time about treating other addictions, such as alcohol or so meth use, and we have counseling services for that. So we could save that for next time. Today's about the opioids.
Does your program help you change habits?
It definitely does. So what's incorporated also with our program is not just the medication, but we also have behavioral therapy, and we have a great group of counselors that are readily available to talk and find ways to, because again, I keep repeating, every case is different, every individual struggles in different ways. So yeah, we have, we just don't have the medication, but we also have counseling and therapy that goes along with it to help you through your focus, through your goal.
I've heard a lot about methadone. Is that better than your treatment? Can I switch between them?
Do you want me to take that?
Yep.
Yeah, okay. So methadone is another opioid agonist, and we don't prescribe that in our program. Usually that's prescribed by a methadone program. It's also a great form of treatment. It really depends on how much tolerance a person has, and we can have conversations about that. But when someone's at high doses of either heroin or opioid use, if if the Suboxone is not covering their cravings, then usually methadone is a better program for that. But that's something we, after consultation, would figure out. Do people switch between methadone and Suboxone? Yes. So someone that's on methadone, they usually need to taper down to about 40 milligrams of methadone daily. And then once they're at that point, we can switch over to Suboxone.
How do you maintain confidentiality? Won't people know I'm coming for opioid treatment?
Okay.
I could take that one too.
Yes, you can.
So one of the things that I really love about our program is, if you know, I don't know if you're aware of Ryan Community Health Center, but we are here for the community. We're a primary care center. We have all ages coming through retreats, women's health, pediatric. So I think that allows the first layer of confidentiality, that when you come in through our doors, you're coming to a health center that treats everyone. So there's a layer of confidentiality there. The next part is when you sign up for your appointment, and the reason why you're signing up for an appointment, there's a layer of confidentiality there too. And the last thing is we follow the HIPAA privacy laws. So let's say if your records need to be transferred somewhere, you would have to sign that you allow the piece about, so you could have all your medical records transferred, but if you don't want information about either mental health therapy, HIV therapy, and addiction therapy, all three that have special jurisdictions under law, that information to be withheld, that can be done. These are really good questions. Yeah.
Well, and it looks like we've run out of them too.
Okay.
Great.
Are we out of time too? Yeah.
Okay.
Okay.
Great. Thank you for joining us. And remember, Ryan Health Network, caring for New York, here for you. Thank you.
Thank you. Bye, everybody.